Namaste everyone. A very warm welcome to today's guest talk titled Integration, Is It the Future of Medicine? The speaker today with us is Dr. Mankul Goyal. He is an MBBS and MD from AIIMS Delhi with a specialization in the field of dermatology. After his MD, he was drawn towards alternative systems of medicine like Ayurveda, Homeopathy, Acupuncture, various forms of energy healing, and evolved versions of allopathy like functional medicine. Having explored these systems, he is following an integrative model of medicine at his clinic named Sampurnam in South Delhi, where various specialties are available under one roof with holism and spirituality at its core. Welcome, Dr. Mankul. We are delighted to have you today with us. Over to you. Looking forward to an interesting session. Over to you.
Thank you, Arunima, for the introduction. And so it's a topic which is very close to my heart. And while we were listening to Mother's music, the prayer that came to me was that may all of us for the next 1 hour um, grow in our receptivity and go deeper into our understanding of what is health, what is swasthya. So, and may we all go deeper into our understanding of what is self-love, which is so much linked to having good health. So, without any further delay, I'll start the session. And integrative medicine, a word which has been around now for 30, 40 years, we'll come to its definition, but what is the need of integration is a very important question that is in front of us. Why do we need to integrate different systems together? And this was something which is a question which is now getting more and more fashionable, and it is coming into vogue, especially after COVID, which suddenly brought the whole medical system to a collapse, and it kind of humbled allopathy and almost every system of medicine where 21st century, we as allopathic doctors felt very proud of ourselves. We can fix any disease, but it really humbled us. So the humbling part really has brought out integrative medicine forward, that no matter how much you know, no matter how much studies you've done, no matter how much billions that has been invested into health, still there are a lot of questions that need to be answered, and we understand the limitations of allopathy better. The second thing which brings integrative medicine forward is conflicting views and extreme views. On one side, there is an allopathic doctor who talks about taking a medicine which is going to help you. On the other side, there is an Ayurvedic doctor who talks about a herb which can heal you. Then there is a healer who says that, I can just heal you with my hand. So there are a lot of extreme views on handling disease, and some of them, take the patient into very um, positive and negative, very polar viewpoints about how things are. So that is another factor which emphasizes the need for integrative medicine or integrating different systems, that there is a lot of extremism in views. Ayurveda doctors criticize allopathic doctors. Allopathic doctors say homeopathy only has steroids in it. So the patient needs some centering. So that's another reason why these things, come into vogue. Another very important reason is that our need for predictability in a treatment. When we go to a doctor and the person is sick, they are not looking for experiments. They're looking for something, that, okay, if I do this, this will happen. It's a very basic need of a human being, that there is some degree of predictability, which is the strength of allopathy. That, it's everything is studied. over and over again. Both for positives and negatives of everything is known to a larger degree. So there is predictability. But at the same time, there's another need of a human being, which is being instantly healed. Sometimes, you've been to an allopathic doctor and you've been seeking a treatment for years and you've not worked out for you, and you go to a homeopath and he gives you one little medicine, and whatever has not been cured for years suddenly gets cured. You may call it magic, you may call it hitting a jackpot, but that's another thing. Somewhere deep inside, we know there is magic that can happen in healing as well. So we both need predictability, and we also are looking for magic to happen, and so integrative medicine also emerges out of it, that both the needs need to be, they are both valid needs of our system, that sometimes we do have to make quantum leaps in our journey, and sometimes it's about slow and steady stuff. So all these things put together set a background for us, that why we are looking forward to, why integrative medicine as a world is coming, is going to be the future of medicine. And that brings us to the question, that what do we mean by integrative medicine? Is it just, putting together these systems at one place? What is the meaning of integrative medicine? Is it a group of doctors looking at a patient like you interview a person and there is a panel of 5 people sitting in front of you? What is the meaning of integrative medicine? So this is just an overview what we're going to go through: a definition, paradigm, tools of treatment, and the challenges of integrative medicine. We just talked about why it is needed. And here is the definition of integrative medicine. And this gives us the essence of this whole talk in front of us in a few words. And this is a definition I picked up from one of the, like we all do, we take inspiration from United States of America. So this definition also comes from USA, fortunately or unfortunately. But yeah, it aligns with how we perceive integrative medicine. And it is integrative medicine is healing oriented medicine that takes account of the whole person, including all aspects of lifestyle. The first point is it takes account of the whole person. And we're going to talk more in detail what whole person means, but it is definitely something more than just physical body. So integration is not just integration of systems, it's also looking at the human system as a whole. It is an energy body, it's a mental body, it's a spiritual body, and a physical body. So it takes, first, it is an integration of the whole human system and not just a physical body. Then it emphasizes the therapeutic relationship between practitioner and patient. So the second integration in integrative medicine is that it is the relationship which heals. The role of the doctor and patient is 50-50. Sometimes in allopathy, it is about the role of the doctor is to create a medicine plan for you, and the role of the patient is just to follow the medicines. If the patient follows the medicines, they have taken care of their responsibilities. The patient asks the doctor, कुछ खाने में परहेज है, कहते सब कुछ खाओ. So it becomes into a 20-80. The role of the patient is 20%, role of the doctor is 80%. But here in integrative medicine, it's 50-50. Both have to come together, both have to be willing to be courageous and work on their health and come 50-50 towards each other. So the second part is the therapeutic relationship and the integration of the two. The third integration is making use of all the appropriate therapies. So that is what we commonly understand by integrative medicine, that, oh, it is going to bring together multiple different therapies, which is, let's say in India, we talk about Ayurveda, homeopathy, allopathy, acupuncture, psychology, nutrition, all these things being put together at one place and into one treatment. So it integrates the whole person, it puts the whole person into perspective, it integrates the role of practitioner, the doctor, and the patient, it integrates different therapies, And the last and most important integration is of making the process soul centered. Why making it soul centered? Because even if we do all these three things, but it is still centered around the ego. What am I going to get out of it? What, as a doctor, I'm going to get out of it? If it is centered around the I, it will eventually lead to compartmentalization of newer kinds. You might put all the systems together, but the Ayurveda doctor will say, "Oh no, I'm right," and the allopathic doctor will say, "I'm right," or so it will eventually will not blend together. So all of them need not all the systems and the patient and doctor don't need to be centered around the I. They all need to do it as an offering to the divine, or as an offering to that deep element within oneself, which is one may call as soul. Even if we don't understand that word, it has to be practically meant for a cause which is bigger than oneself, bigger than me or you. It has to get a cause which is bigger than us. And one of the simple ways to do it is when self care becomes the cause, then it becomes better than being self centered. When we are caring for ourselves, then care is a word which goes beyond being self centered. Care is a very broad word. And as a practical means, there are many people who don't understand what is soul, or don't connect to that word, or don't connect to spirituality, but they'll very well connect to word self-care, and it immediately takes them beyond I or you. Self-care brings care for everyone, right? So this is the definition of integrative medicine. And next we move on to the paradigm of integrative medicine, because paradigms are very important. If we have the right paradigm, then we can actually look at things in one fashion. Because if you look at from an allopathic perspective, which is a kind of a Newtonian physics paradigm. Newtonian physics is that this is matter, and whatever you see through your eyes is the truth, and human body is like a machine. And even the thoughts and emotions that we experience, they are a outcome of certain biochemical reactions happening in this machine. And if we are looking for a treatment, or if there is a disease, there is something wrong with some circuit in the machine, and all we need to do is to fix that machine. That's why it's a very popular word these days. How can I fix my disease? How can I fix my body? How can I fix my health? This fixing comes from there is something wrong in the machine, that kind of a paradigm. Now, if you're looking at human system from this paradigm, it will be very difficult to have an Ayurveda and a homeopathy doctor or a healer sit in front of you, because the Ayurveda doctor will say that इसका तो शरीर में गर्मी बहुत है, इसके शरीर में ठंडक बहुत है, and इसके शरीर की वायु बढ़ गई है. Or the homeopath will say the seed of the disease is in the mental layer. So if the allopathic doctor is in this paradigm, whereas an Ayurveda and a homeopath or a healer is talking in a different language, then there can be no proper communication. And when there is no proper communication, we can forget about integration. So the integration calls for us setting a paradigm which is acceptable to an allopathic doctor also, whose main idea is to stick to science. Because that's what people come to an allopathic doctor for, because the person is truly seeking scientific answers to things, and they're looking for predictability. They're not looking for ideologies and philosophies which are there in ample amounts, but they're looking for science. So, what is that scientific paradigm which is acceptable to an allopathic doctor, Ayurveda, homeopathy, healer, any different field, is the question in front of us. And that paradigm, one can look at it from a quantum physics paradigm, where it's now, I think everybody understands this, what Einstein brought up, that particles and waves are interconvertible. So energy and matter are interconvertible. Whatever we see as matter can also be seen as a wave of energy. And the second part of this paradigm is that any wave carries information. Right now, through these, what we are, I mean, this transmission of information is happening through energy, those waves of Wi-Fi and internet signals carrying from one place to the another becomes a medium for carrying information. So it brings us to a paradigm that human system is a continuum of matter, energy, and information. This is something which is acceptable to an allopathic doctor also, and also to a homeopath and Ayurvedic doctor as well. And it is pretty much provable. There's nothing, no more is it just philosophy. It's a fact that we are a continuum of matter. We can see ourselves as physical matter also. We can see ourselves as a ball of energy also. And we can also see ourselves as a mass of emotions, thoughts, belief systems, and much more. And this is a very simple experiment done from heartmath.com to kind of prove the energetic nature of human beings, where they showed that they detected the energetic signals of another human being in the magnetic field of, let's say, a person is sitting in the room and the other person is outside in another room. The energetic signal of that person can be detected in the person sitting inside the room, in his heart, in his ECG, in his magnetic field. So this is something which heartmath.com, after a lot of labor, were able to show, and it kind of reflects the aura or the whole energy layer that we carry around us. And there are a lot of such experiments, but this comes from a credible source, so that matters. So we are a continuum of matter, energy, and information, and of course, spirituality goes one step ahead, where it says that whether it is matter or energy or information, they are all made of one common substance, which is consciousness. This is something which one can go one step ahead, but um, even if as allopathic doctors we stick to matter, energy, information is enough, but those who are interested in spirituality do understand that consciousness is that substance of which mind is also made, energy is also made, and matter is also made. And now, once we set this paradigm of being a continuum of matter, energy, and information, it is much easier to understand the principles of Ayurveda, where the energy of a person, matter, energy, information, has been divided into 5 elements. The matter being a more coarse or dense form of energy, and mind being a lighter form of energy, and it is reflected in denser form of energies as earth and water, and slightly lighter forms of energy as fire and air, and even more subtler elements as ether. And then there are 3 doshas which are classified based on that. One is vata, which is predominantly ether and air, the most subtle element within us, which constitutes our soul element, our spiritual essence, and also our mind. And then there is pitta, or fire and water, which reflects more of our metabolism, and kapha element, which represents the secretions and the solid base of matter that we carry within ourselves. So these 3 doshas are very well understandable now from the perspective of matter, energy, information, and every individual is a differential combination of these 3 doshas. And based on the differential combination, a vata person who is more of a thinker and who has air element high is relatively lean and thin. A pitta element, which is higher on the fire element, is the go-getter and is fiery and is more prone to headaches, migraines, acidity, or those kinds of things. And a kapha element, which is more dense, is known to be more sluggish, and slow, yet at the same time more anchored, because matter is more stable. So he's known to be more stable, unlike the vata, whose air element will spring from one place to the other, will keep moving and shifting. So based on this understanding, we can come to conclusions which an allopathic doctor can't. It'll take allopathy ages to draw conclusions and treat patients based on what the Ayurveda Vat Pitta Kapha does. For example, as an Ayurvedic doctor, as an allopathic doctor, I used to give diets to patients. The moment I started looking at the Ayurvedic perspective, it became so much easier to connect to the patients, because you could clearly see, okay, this is a Vata person. He is high on his thoughts and emotions. He needs to be anchored, and you give them oil to apply on their body, and they immediately get soothed. Now, this is something as an allopathic prescription very difficult to give, but it's something very simple to do, and the person immediately feels better. A pitta body type, it's heat and hot in the body. It's very simple for that person to understand that I need to avoid spices. I need to avoid those kinds of things which will make me more fiery, the coffee and the teas. And you immediately connect why it is more important for the pitta body type than for a kapha. For a kapha, a cup of tea will give him energy and get him moving. So maybe for that person, it is a much better deal to take a coffee. So it's something without really intervening too much through medicines itself. It can make a profound impact into a person's life if we are ready to leave the paradigm of that we are just this physical body. And so much, and there's so much more wisdom in Ayurveda. It's a complete system in itself. The same with homeopathy. Homeopathy also um, is a form of medicine where the the you take one molecule and you keep diluting it, you keep shaking it, you keep diluting it. In a philosophical term, what you're left with is the energy signature of that molecule. And so this has an impact on the energetic body of that person, the prana of that person, or on the mental layer. Now, for an allopathic doctor, it's again very difficult to understand, because the moment you go beyond dilution of 10 raised to the power minus 12 to the 12, there's hardly any molecule left in it. It's just plain water alcohol. So, for an allopathic doctor, it's very difficult to understand how something without any matter in it can be effective. It has to be a placebo. And that's why homeopathy is known as a placebo. It's being called as labeled as placebo in many countries. But if you have that matter energy information paradigm, it suddenly becomes more profound that, wow, it's an energy signature without the side effects of carrying matter in it. Although now there are more physical explanations coming up for homeopathy as well, but still, in this paradigm, it's easy to understand. And there's another beautiful thing, that when we try to address a disease at a matter level, the disease may be seeded at an energetic level or at an information level. Some people, the disease is in the mind or the mental layers. For some people, the seed of the disease is in the energy layer. And for some people, it's an actual physical issue. You get a road traffic accident, you don't say that I'm going to cure this with homeopathy. You will go to an hospital and get it fixed. You will get a plaster. You need a physical thing at that time. But when the issue is at the prana level, when the prana is blocked because of chronic stagnation, you're sitting at one place and your energy is not moving, and the issue, and you're sitting with all kinds of emotions in your being, and the prana starts to get blocked. That is the time where just going to a doctor and taking a painkiller will not solve your issue. It may numb you to your pain, but it's not going to solve your issue. And that is where that energy signature of homeopathy can come forward and heal you. Or that is where an pranayama of Ayurveda, where you sit down and just to get your energy moving, can really help you. So that is the beauty of homeopathy as a system. And this then brings us to how a integrative medicine doctor will view the disease. So what we've looked at till now is why integrative medicine is important. Then we looked at what is the definition of integrative medicine. Then we talked about the paradigm that any person who's looking for as a patient or as a doctor to practice it, what paradigm they need to carry. And the next is that how do you view disease in um, in the integrative model. So this is a beautiful way to look at it, is the iceberg model. The iceberg model is the tip of the iceberg is the disease that you are having. Let's say somebody has, let's take one of them, let's take psoriasis. I'm a dermatologist. Psoriasis is a skin disease where you get red flaky patches on your skin. So what is visible to that patient is that I have these red patches, flakes on my skin, and how do I get rid of it? So that person's focus is tip of the iceberg. And the next question that that person has is, how can I cure it? So they're seeing the tip and they're asking, how can I shave this off? That's the question in their head. How can I get rid of this? Our job as a doctor is to make them aware of what is underneath. There's a whole thing which is underneath, which is first a combination of dysfunction. So dysfunction is there are certain hormonal issues which might be happening. There are certain nutritional deficiencies which may be happening. There are certain physical blockages. There may be growth of abnormal bacteria, fungus in their gut. Their liver might be clogged with toxins. There may be heavy metals in their body. There may be acid-base imbalance in their body. There might be foods they may be allergic to. There might be inflammation in the body. So these are all words that we use which can be validated based on lab tests, but they reflect what is the biochemical dysfunction which is going on in the body. Now here we are talking about matter from a matter perspective, which can be validated based on blood tests or some form of scientific evaluation. And underneath this biochemical dysfunction is another great layer of life choices. How do we choose to live every moment? What do we choose to think? What do we choose to eat? What do we choose to do? We follow our swadharma in our life? So another simplest thing is, are we following our swadharma of every moment, or we are getting influenced into another thing? And that swadharma is at a professional level, at a relationship level, at a food level, at a level of self-care of the body, a lot of different choices. So all these things are lying underneath. So when we sit down with a patient, or any integrative medicine doctor sits down with the patient, the discussion is around what is your symptom, what is the biochemical dysfunction underneath, and what is those life choices which have fueled this biochemical dysfunction in this disease. And here the life choices we are talking about is not just of that individual, but of the collective, of their environment, also the life choices of the ancestors, which we may call as the genetics of the person. So all of them come into account when we are trying to understand how the disease is happening. And here the word cure takes a very different meaning. Now the patient is not looking for a magical chopping off thing. That would purely be a symptomatic treatment if the focus is here. Now we are looking at a synergy between some symptomatic treatment which will give the relief to the patient, some biochemical dysfunction work through allopathy, Ayurveda, Homeopathy, be it whatever, depending on the kind of biochemical dysfunction. And then eventually we are looking at the life choices work of the individual, their environment, of the whole. When we are getting all these three and the synergy of the three, this starts to go down. Very gradually, it starts to go down and starts to go underneath. And that is where the person gets better and better. And as this burden of iceberg starts to go down further, the person also starts to develop buffer. That means when they, in the initial stages, the disease is there always, Then the disease comes when they're under stress. And then eventually the body develops the resilience. Even when they're under stress, the disease doesn't tend to come back. And this is a very different definition of cure from what, as a lay person or as a person who suddenly gets a disease, they're looking for, some doctor with some magical pill and it's going to go away. So these are some examples. This PPT presentation was meant for doctors, but just to give you a very simple example, this is a girl, 12-year-old girl, who came to us with few strands of white hair. And what we discovered in the biochemical disorder, now that's the tip of the iceberg. She had a few white hair, that's all. And what we discovered on her biochemical dysfunction front was fatty liver, insulin resistance, prediabetes, gluten sensitivity, iron deficiency, D3 deficiency, B12 deficiency. So this gives us an idea of what's underneath. And if there is so much underneath, there has to be something underneath in the life choices. So that girl was going through a lot in many different ways. And then we account for each of them. So this is the iceberg model with which we are viewing things. Now, one very important thing is, how do we connect the different layers? How do we connect the tip to the biochemical dysfunction? And how do we connect the biochemical dysfunction to the life choices? Sometimes, or most of the times, we are viewing or understanding things from our intellect, which interprets things in a linear fashion. Oh, I have a viral infection. I have a fever because a virus has attacked me. So I have the virus. I have COVID. So COVID has to be the culprit. So I take care of the COVID. I find the best antiviral or the best way to, or the best sanitizer to, I'll carry it everywhere and I'm going to protect myself with a mask. And so this is linear thinking, that virus is the cause for my disease. So B is happening because A is there. C is happening because B and A came before C. Whereas the fact is that everything in this universe is impacting everything. Everything is interconnected to each other. And linear thinking is largely a reductionistic approach, to simplify things for us. But every disease that a person has is affected by innumerable factors, external and internal. So any such thought process, I have body ache because I have thyroid, is a reductionistic approach, simplified approach. The fact is, there are infinite reasons or infinite factors connecting. You may you may improve linear thinking by giving out multiple factors, by saying that, okay, these are the top 5 factors because of which the disease is happening, or by giving a trigger susceptibility model. So the trigger susceptibility model is that if there has to be a fire, then there has to be a matchstick. But matchstick is just a trigger. Just matchstick cannot light a fire. There has to be wood and fuel for it. Then only the fire can be lit. So matchstick is the fire, and wood and fuel is the susceptibility. COVID can be very harmful for a person only if the person, the internal health is off. If there is diabetes, if there's prediabetes, there's obesity, there is inflammation, there is stress, all these factors which make a person susceptible to allowing the COVID to enter and take hold of the system are equally important. So there, the person's focus is not entirely on कि virus की वजह से मुझे infection हो गया, but you are also viewing from a susceptibility. How susceptible am I? How good is my immune system? And that's why the whole talk around immune system emerged during the COVID times. How can I boost my immune system? So, but it's very important to remember that we all try to reduce things to linear, but everything in this universe is connected to everything. And that brings us to that humility. It's humbling for all of us. No matter how much we understand, no matter how much we know very, very little. And eventually, That's why the deeper element, the soul element, the awareness element, the surrender element, the faith element is so very important in any treatment. Another very important aspect of integrative medicine. So we've talked about, I'll go over it, talked about why integrative medicine, talked about the definition of integrative medicine, talked about the paradigm of integrative medicine. Then we have talked about the iceberg model, how we are viewing the disease. And now we are talking about the mental aspect, or the again, these are all parts of the paradigms which are very, very essential. Why we talk move, why it's very important to move out of the linear paradigm to an infinite paradigm, to bring in that humility. And why this next thing is important, we'll talk about it. It is very important to acknowledge that whatever disease and dysfunction we have, still a large part of us is healthy. So when we talk about this iceberg and you start thinking, oh, I have this tip, but I have so many other things happening inside me, one can suddenly get overwhelmed. One can start thinking, oh, I have so many different things, and how am I going to take care of them? There are so many problems with me. And we go into fear, being overwhelmed, or a state of not enoughness. And then we try to fill ourselves. Now, again, there has to be some supplement which is going to fill this up in me, or some medicine which is going to solve my problem. That is the paradigm we get into. But here, it is very important to understand that health is always dominant. No matter how sick you are, still 99% of you is healthy. Or let's say 97% of the biochemical reactions which are happening in the body are absolutely fine. That's why you're walking. That's why you've landed up in a doctor's clinic. You could walk, you could breathe, you could speak. So, integrative medicine teaches us gratitude again, that no matter how sick you are, 97% of you is still healthy. And we need to bring our focus back to good health. We need to ask ourselves how I can be grateful to this quiet good health within me, which has still quietly been taking care of myself, no matter how much I've abused my body. And the focus is this 97%, asking this 97%, what can I do for you? And I'll tell you the same old things. Acha khao, acha piyo, acha so, अच्छे सोच रखो. And you will, from that gratitude, do it. And the health grows from 97 to 98, 98 to 99, 99 to 99.5, and the disease fall away. So that's the gratitude based model, enoughness based model. Whereas very often what happens in allopathy is, or even in any system, when you go to a homeopathy or Ayurvedic also, your focus is 3%. What disease do I have? How do you fix my disease? That's what our concern is, the 3%, where we are centered around the disease and fear. And in process, the medicines that are given sometimes block the function of the 97%. So you may get symptomatic relief, but the quiet good health continues to go down. And that is where integration comes in. Integration is about, yes, we may need a symptomatic treatment for a while, but we need to be constantly reminded, how are we expanding that 97%? If that is happening, then we are truly moving forward in healing the disease. So iceberg model is one place, but at the same time, not to be overwhelmed by the iceberg model, and to be able to see that I'm still very healthy and I'm grateful to that quiet good health is very important again. Because if the doctor, I may be talking about this, but it happens to me as an integrative medicine practitioner, if I am getting overwhelmed by a patient's disease, then I would switch to that 3% focus. I would not be able to focus on that 97% in him, and I'll get desperate in giving answers to that patient. So this is a very important. Courage and faith and gratitude is very important to integrative medicine. And from there starts the joyful journey of treatment, where there is symptomatic treatment, there is work on dysfunction, there's work on causes, and we start looking at the food choices of the person. And the food choices go beyond how much protein you're having, how much carb you're having, how much fat. We don't look at food like it's a very common term. I am now eating my carbs, now I'm eating my protein. But whereas food is, to look at food again as energy, and does it have life in it? Does it have prana in it? If you sow a fruit, it will grow into a plant, so it has life in it. Whereas if you sow a roti, dal, sabzi, it will rot. So you cannot just classify food based on protein, carbs, and fats. There has to be classification based on energy, prana in the food. Then customizing food based on Ayurveda body type, Kapha body type can have tea and coffee. Pitta body type needs to avoid it. Vata body type needs more fats and nuts and seeds. Then food intolerances. They are a big reality of today's life. Gluten, dairy, yeast, soya, these are very common sources of inflammation in the body. And eliminating them gives the patient a lot of relief. Then, tea and coffees are the bed tea is a gift from the English culture to our country. And I remember one Ayurvedic doctor once telling me that, see, the only purpose of Ayurveda is to connect your man and buddhi. Your man goes to places and buddhi is meant to keep it anchored into wisdom. And if the man and buddhi are connected, then you will make wise choices and everything will be fine in your life. And one of the commonest example of man and buddhi disconnection is uh, individuals these days, first thing in the morning, they'll pop in an antacid and then they'll have a cup of tea. So, which is dissociation of man and buddhi, so very common that we see these days. And so we move from teas and coffees to herbal drinks. The quality of the food, the organic nature, what to eat, when to eat. So the timings of foods these days for people have become into an inverse pyramid. We're eating more in the night, less in the day, whereas your digestion mimics the sun. It peaks in the sun with the sun and it goes down in the evening. So you may be having 1,000 calories, but those 1,000 calories in the night will be undigested to a degree and create toxins. And the same 1,000 calories in the day will go into your muscles, into your body, and provide you energy. So the same food, when it is eaten, has a very different impact. And last is how we eat. Are we eating in a hurry? Are we eating while watching TV? Because food is a ball of energy, and whatever thoughts and emotions you are exposed to at that time, it is absorbing all of those and they're becoming a part of it. So, gratitude while eating every day will make your system whole and grateful. And lastly, in integrative medicine, another very important thing is, and that's true for life, being a role model. If you don't practice it yourself, because we are talking about the therapeutic relationship between doctor and patient, it's not just saying things. This energy will go to the patient only if you are carrying that energy within yourself. So for the doctor to practice all that they're talking. And then, of course, exercise. Don't want to go too much into it. We all understand. But here it's then doesn't become just about shedding weight by calorie deficit कि आपने exercise ज़्यादा किया और खाना कम खाया. But here it becomes about in the physical body letting go of the blockages through pranayam, through qigong, through tai chi, through yoga. All these things, when you let go of blockages and make your energy body light, sometimes obesity is just purely blockages in the energy body. And when the energy body becomes light, then the physical body also becomes light. And then, of course, addressing the mind, which is a very important layer. We have our subconscious mind, which is carrying all kinds of stuff. Basically, a child before 7 years of age is absorbing everything, whatever they have acquired. So, I mean, again, from a spiritual perspective, a soul comes with its sanskars from the previous lives, and then it integrates into a body which is carrying the sanskars and the karma of the ancestors. And then it is being exposed to certain environment over the first 7 years of their life. So these three things are really influencing big time. There's something called ancestral healing, where you actually go into the seed of a certain sanskar at an ancestral level, how remarkably beautifully it works. Past life regression, sometimes it's not coming from this life, and it is coming from some sanskar which is seeded in the past life. And then, of course, what we experienced during the childhood. And then, as a mass of all this, a person is then reacting to every situation in their life. And the emotional healing is a combination of healing of all these three elements and learning to live life in the present moment in such a way, reaching a point where you are so intensely present in every moment that you can witness, because this load from the past is infinite. You cannot keep having sessions with others. You allow these reactions or these sanskaras to emerge in your conscious mind, and you have a clear capacity to witness them and transform these sanskaras without being identified from them. So, what one may call as mindfulness or capacity to witness. Um, and that is what spirituality is about. So, beyond a certain point, after the person has become aware of all the stuff in the subconscious, that super conscious capacity needs to come in to be able to transform each of the sanskara, which is an endless journey for both the patient and the doctor. The doctor is no saint. The doctor himself and the doctor will attract those patients who have some similar sanskaras to work out. So it's the like attracts like in the energy. So it is has to be, the more the doctor can master certain sanskaras, the more he can also facilitate the same for the patient, or witness within himself can also help the patient with the same. And then there are a lot of different therapies built around this model of clearing up the subconscious, helping a person develop their connection with their own superconscious, and go through this process of addressing the mind. Another very important element is the sleep. And sleep here is, today, these days, we talk about 8 hours of sleep. I'm taking 8 hours of sleep and I'm good. But the most important element is the timing of the sleep. So in this chart, you can see if you are in dark, as sunset happens earlier, by 8 or 9, you will start making melatonin, which is your sleep or main healing hormone in the body. And it will go up and it will stay up till 3, and then it will start coming down. So your body's main healing is happening between 10 to 3. And why it goes down after 3 is because our body is linked to earth and sun, and your body now needs to start making other hormones. But if we are exposed to bright lights, LEDs during this time, we don't make any melatonin, and it's almost nearly zero. And if a person decides to sleep at 2 or 3, they will make some degree of this, but very little. And we will be carrying previous day's toxins over to the next day and more disease. So it's very essential to sleep on time. A person sleeping at 9 or 10 and waking up at 3 is going to feel still very fresh. But a person sleeping at 3 and sleeping for 12 hours will feel still groggy. One can do this and try it out and see in one's practice. If you've taken those 4 to 6 hours of that sleep, you will be fresh, largely. So this is a very essential element, and COVID times has brought a major shift in this, and that's why we're seeing teenagers getting a lot of health issues which were unheard of at that age, like gallbladder removals, or fatty liver, or balding, or so many other diseases which were very rare earlier in teenagers. And then, of course, one of the elements that an integrative medicine practitioner tries to make use of is minerals and vitamins, things which are already present in our body, trying to maximize on them. One can see them as, if we see our system as a mobile phone, then in this mobile phone, the battery is these vitamins and minerals, and the charger is our spiritual and the pranic energy. So if either of them are missing, there is trouble. If the charger is missing, if you're not sleeping, or if you're not emotionally healthy, then you might have a new mobile phone with a new battery, but it will not work beyond a certain time. And you may be doing your meditation and you may be doing everything else, but your vitamins are not proper, so the spiritual energy is not anchored into matter. So these vitamins and minerals are anchors of spiritual energy in matter, and they are beautiful, simple, and safe ways of inducing healing in individuals. So they become a major cornerstone of of doctors, especially coming from an allopathic system, to help facilitate healing of patients. And then same about antioxidants and plant extracts. The nature of plant extracts is that they have multiple targets of actions and they work on the DNA. Most of the allopathic medicines, they're working at a very superficial symptomatic level, whereas most herbs go and affect our DNA, depending on their mode of action. So they induce a much deeper healing, albeit slower. When something is acting on your DNA, it will start acting or start showing its results after 3 months. So with Ayurveda, one needs to be patient. With allopathic medicine, you can see result within a few days. But with Ayurveda, you need to wait for 3 months in order to see benefits. And then another very important thing is what kind of a story a patient carries around a medicine. We may be doing all this, but if the story of the patient, the placebo is a very important aspect. Placebo is not just placebo. There was a profound study done on taking certain 20 patients of knee injury where their ligaments were torn, and there was one subgroup which was operated and surgically mended, and there was another subgroup where they were taken into the surgery, but their knee was cut open, but it was stitched back without any mending of the ligament. But the person carried the belief system that I have been operated. And after 1 month, both the subgroups were going and playing sports. So it's the power of placebo. What do we believe? If we believe, it can actually heal us. So having a good story for a patient, that's why it's very important for a doctor not to just hurriedly explain the medicine, to have a story around every medicine. Because the medicine is 30%, the story is 70%, what you're carrying around it. So, and that's true for both doctors and patients. Patients actively also need to build faith rather than doubt around the medicine. And then, of course, as we just discussed, when there is integration, no one person can do it. There have to be a group of people who need to get together, and they need to accept their differences, and they need to center themselves around a cause which is bigger than each one of them. And that is how different systems can come together. And there are various different therapies which are helpful in the process. And these are some case studies which I generally share with doctors. But lastly, very important is that eventually awareness is a very big healer. It is not necessary that very often we feel there is a problem and we need to fix it or we need to act upon it. But the power of witnessing is such, when you witness something happening, you don't need to act upon it. You can address it. If there is a dark room and when the light comes in, the room naturally gets illuminated. So when we become aware of something, naturally light is shed on it and that issue gets addressed. We don't need to necessarily go and fix it actively or control it. So awareness has a huge healing capacity. Less is more. Sometimes we think we need to do more in order to heal. Sometimes we need to do less. A little pill can do much more than 10 different treatments. So less is more. Awareness has the capacity to heal. Um, these are some of the key. We don't need to fill all the holes in the boat. Sometimes we can discover 10 different things. Oh, this is wrong with me, this is wrong with me, these 10 things are wrong with me. I will only heal only if I fix all the holes. Not necessary. Look at the most important things which are going off in life, and if we take care of it, things get better. And the last is 5 layered wellness. So what we talked about, the 3 layers: matter, energy, information, and there are 2 layers beyond it. In yoga, there is concept of Annamaya Kosha, or the physical body, Pranamaya Kosha, or the energy body, Manomaya Kosha, or the mental body, and then there is Vijnanamaya Kosha, or the supramental body, and Anandamaya Kosha, or the bliss body. So we aspire for that 5 layered wellness in integrative medicine. I'll go back to how beautifully Americans are gifted with, they write down into points everything. And so this is how patient and practitioner are partners in the healing process. It involves the mind and the spirit and the community as well as the body, use of all the conventional alternative methods, and trying to use natural and less invasive ways. Integrative medicine neither rejects conventional medicine nor accepts alternative therapies uncritically. कि ये तो natural है, ये सब अच्छा है. Good medicine is based in good science. And lastly, the doctor himself has to be a role model and commit himself or herself to self-exploration and self-development. So these are some beautiful points mentioned in what integrative medicine is about. And with that, I leave you with also some challenges with integrative medicine. There's a lot of time involved. So it is not a 5-minute consult, it involves time. There is the subjective element, the philosophical element does get involved in integrative medicine. Sometimes you can end up doing too many things at the same time. So there can be a khichdi. There can be cross interactions of different groups of medicines. There can be blockages in the patient mindset. Um, Sometimes alternative medicine can also have a lot of pride. We talked about pride of allopathy, but Ayurveda, homeopathy, having had some miraculous cures, creates pride in the practitioner, which prevents the amalgamation of different therapies. There can be commercialization. Again, the focus is gone from what was the purpose to act out of a space of no personal gain. And then the last challenge is, of course, bringing people together. So I thank you all for patiently hearing. I don't know how much time I've taken, Arunima, but thank you for patiently hearing this, and I hope we have all in this moment, and all those who are going to listen to it later will grow in our depth of understanding what is swasthya and what is good health, and we all pray for a model emerging in future where integrative medicine becomes a part of day-to-day life. Thank you so much. God bless everyone.
Thank you, Dr. Mankul. Thanks a lot for this beautiful session. And I'm very sure it's helpful to all of us. So many of us would relate to the topic today. And referring to one of the points that you mentioned, being a role model, I can definitely say that you are a role model yourself by way of self-exploration and self-development. Thank you so much. It was very helpful. Uh, I open the session to the participants as well. If anyone has a query or someone wants to share something, please go ahead. Please use the chat box or raise your hand. I can
Thank you, doctor. Can you hear me?
Yes, sir.
Yes.
Yes, you have made a very good point, but we love this idea of integration, integrative medicine, in which the strength of all different therapies could be assembled together for the benefit of the patient. But where do we find such a capability of a doctor in our everyday life? We don't find such a person in our place where who can integrate and then give a cohesive solution. Can you guide us?
So yeah, I mean, such doctors are very few. I can say that, personally, we have been aspiring to do that, and we are in Delhi in Hoskas running a center called Sampurnam, where I'm there and I'm a holistic dermatologist, a holistic physician is there, a holistic cardiologist is there, an Ayurveda doctor, acupuncture, physiotherapy, healer, psychologist, nutritionist are all part of one team. And so we are trying to do this work. And as you just said that, it is challenging, and it is challenging for us every day. All that we do is we try to, offer it to the divine as a service as much as possible, so that we keep getting refined every day. And there are many such centers opening up all across the country and the globe. So if you type integrative medicine, if you type functional medicine, you will hear of a lot of doctors all across the country and the world who are aspiring for the same. So yeah, it is now available. Um, Binod ji had said that, can we consult online? Yes, of course, we do. Everybody does online consultations these days, so we are available. Most welcome.
Thank you.
Thank you. Dr. Mankul, Vinod ji has also requested for your contact ID, if you can put it in the chat box. And Shreya has raised the hand. Please go ahead, Shreya.
Good evening. Thank you, Dr. Goyal. The session was extremely informative. I've also heard you in ashram also. So this was like extremely enlightening. I'm a PhD scholar at JNU. I've done my bachelor's in physiotherapy. And the topic of my PhD research is to look at the integration within biomedical professions, the status and role of physiotherapy in India's healthcare system. So this is my PhD, and I've completed my data collection, and now I'm in the process of writing my thesis. And I just want to thank you for this such an informative lecture. I mean, coming from a dermatologist, so it has really helped me to connect so many dots, because one of my questions is also about because there was a study in Lancet that said homeopathy is placebo. And I've asked, so in my data collection, where interviewed doctors also and physiotherapists and patients. So I've asked them, do you think physiotherapy is an objective science, or is it a placebo? And even about other Ayush sciences also I've asked them. So I think and the way you have explained about the energetics and about homeopathy, I think that was extremely helpful for me to understand also from that lens, and even the paradigms also. So even the model that you have given, the iceberg model, because even I was thinking how physiotherapy, which paradigm it follows, and how it is treating patients. So I think that was a very helpful model to understand. So any so from your lens, I wanted to ask you, how do you see this field also, because you have discussed about Ayurveda. So it just I wanted to ask you, how do you see physiotherapy also integrating in this system?
Thank you, Shreya. And thank you for the wonderful work you're doing. And we should definitely connect sometime. And love to learn from you. But I always tell people I envy two people. One is a nutritionist and a physiotherapist. They are creating such good karma for themselves because you're not giving anybody any medicines. You're just empowering them so much. These are two people in allopathic setup who are doing actually very good karma. So, a physiotherapist, actually, if I have some issue, I would rather go to a physiotherapist than to an orthopedic doctor. And personally, I've had a knee issue in the past, so I always allowed my visits to a physiotherapist rather than a orthopedic doctor, because basically, if you look at it from the paradigm of matter, energy, and information, the physiotherapist, by helping restoring the flow of energy, because when you even do just the strengthening of a particular muscle, you are improving the flow in a particular energy channel in the body. Like in acupuncture, there are energy meridians. Let's say, for example, you would understand it like vastus medialis, which is the medial group of muscles in your thigh, where the kidney meridian goes through. The in acupuncture, the kidney meridian, the liver meridian. So when these organs are clogged, then vastus medialis very often gets weaker. And when we are in the regular sitting posture every day, where we are not sitting cross-legged and the vastus medialis is not being used so much, and they go weaker, then the kidney and liver meridian go weak. So, and kidney processes the emotion of fear, liver processes the emotion, a lot of different, it's a master processor of emotions. So, the effect this has is at the level of the mind, it has the level of those organs, and is at the level of flow of the energy in the body. And just a simple act from going to a physiotherapist and learning to exercise that muscle helps restore a lot of things for the patient. So how beautiful a thing it is. And integrative medicine is not so much about fancy things. It's about appreciating these little things and doing them well. And actually, the fact of life is you do one thing properly, you get better, right? It's not about doing 10 different things. That's why physiotherapy, even though it's a pretty much an allopathic system, still does a very deep service in terms of integrative medicine for any individual. So yeah, I mean, and then nowadays physiotherapists are, when I learned acupuncture, there were 5 other physiotherapists who were learning acupuncture along with me. So I know how easy it is for them to pick up because they understand the dynamics of body so well. And then now the newer branches of physiotherapy, osteopathy, and chiropractic, osteopathy is about visceral manipulation, understanding the emotion entangled in each organ. So a lot of exciting work they are doing through physiotherapy, through body work, in helping resolve a lot of physical issues of people, chronic disease of various kinds. So that way I deeply value, and that's why in our clinic also there's a physiotherapist come acupuncturist, and that's one field apart from nutrition and psychology. So actually these three, psychologist, nutritionist, and physiotherapist put together, can put a lot of doctors out of work.
Thank you. Thanks a lot, Dr. Mankul. Words of appreciation for you in the chat box and for the concept also about the promising future of integrative medicine.
Thank you so much, everyone.
Thank you again for a wonderful, beautiful session. And I thank the participants as well for being with us today. We can close today's session with a moment of peaceful silence. Namaste.